We now have some encouraging news on the COVID-19 front. Around the nation, including right here in Alabama, there's a consistent downward trend in COVID-19 hospitalizations and cases right now. Here's how things are holding up here at home.
Just weeks ago at DCH Health System campuses, they were treating 165 COVID-positive inpatients. Today, that number has been more than cut in half, down to around 80.
The total COVID-positive inpatient numbers have been going down at DCH. At the moment, we're at about 80 total COVID-positive inpatients, and 22 of those are in the ICU. So if you look back just a few weeks ago, we were well into the hundreds, and even a little further back than that, we were at about 165. So the numbers have definitely been coming down.
So what's behind this decline?
Well, in part, I think it's time. You know, people have gotten the virus, they've gotten sick with it, or they've gotten vaccinated. And those two things have really increased the numbers of people in the community who have antibodies. So because of that, less susceptible to the disease and fewer people are needing hospital care.
But we've seen numbers much lower than even these current stats since the pandemic began. This is prompting Vice President of Marketing and Communications at DCH Health System, Andy North, to remind West Alabamians to not let their guards down.
Back in January, we were up around 199, or we were at 199 COVID positive inpatients, and we thought maybe that was the top of the top. But the numbers went down substantially. We were down well below 10 at one point, then they came back up. So it just goes to show that this really could come back around. There could be another variant. There could be a pocket of individuals that still haven't been exposed to it. There are lots of different factors. I think we really need to be vigilant. We need to continue to wear masks when we're indoors and we're with groups of people where we can't socially distance, and we need to get vaccinated.
With fewer COVID-positive inpatients, more space is now available at DCH hospitals. North says the biggest challenge they are facing now is staffing.
We've struggled over time to get the staff that we need, or to maintain the staff that we need to take care of these patients. Right now we're doing better, but it could always be better than that. So we really are encouraging the community, if you know a nurse, CRNA, respiratory therapist, etc., encourage them to come work with DCH. We'd love to have them, even if it's part-time. We would still love to have them because we need the help.
To learn more about job opportunities within DCH Health System, as well as their latest COVID-19 data, you can always visit them online at dchsystem.com.